Happy Friday, everybody. It's Dr. Bridget Young from babyformulaexpert.com here on another illustrious Friday for Happy Hour. Today, we are going to be talking about the one thing that you can do to ensure that you are going to get off to a great start with breastfeeding. Now, my nose here. That is not a horribly sensationalized headline. I don't know what it is. And I just couldn't help myself. There is, of course, not just one secret to magically having a perfect breastfeeding journey. But again, I just couldn't help myself. But I want to talk about one thing that I think is often overlooked that can really help get you off to a great start with breastfeeding, particularly with your breast milk supply. And this is hand expression. So I'm going to spend the next 15 to 20 minutes talking about hand expression, the logistics, and why I think it's so fantastic. And then we'll wrap this up. The reason I started thinking about this is, normally I talk about what to do after the baby is born and not necessarily preparing for the baby. But I am very excited to announce that I am going to be speaking at a virtual baby fair / parent summit called Parents to Be. So I will, of course, be talking about baby formula and how to go about choosing a baby formula. But I've been, networking with there's a lot of prenatal oriented practitioners talking. And so there's been a lot of discussion around this kind of thing. And so it got me thinking, I'm going to talk a little bit about that. I got opinions and Facebook's free to share your opinions. So if you're still listening, I'm going to give you mine. If you are interested in attending the Parents to Be Summit, it looks like it's going to be really awesome. There's over $8,000 in discounts and giveaways. There's 53 expert speakers on a huge variety of topics, all related to new parenting, and it's all online. So it starts February 1st. All the sessions are in the evening online, but they're all recorded, so you can watch them later if you're not particularly free. So if you want to go buy a ticket, head over to for ease, babyformulaexpert.com / expecting. And then I have all the links, all the details there if you want to see. So, you okay, PD? Okay. The boys are here. So let's talk about hand expression. I pasted something. I'm going to paste a comment in here so I can refer to it. Oh, shoot. It's not the right comment. Hold on 1 second while I search for this comment. And so when I talk about, all right, here we go. I'm so sorry about the delay. I think I have this ready. I thought I did. Okay, so there's 2 links that I want everybody to be able to access. One is the link to be able to buy your ticket to the Parents to Be event. The other is a video that I'm going to mention pretty much right now. So hand expression, often overlooked, super awesome, especially in the neonatal phase, which is, roughly the first 30 days. So here's why I love it so much. It's super easy, meaning way easier than pumping. You got boobs, you got hands, you don't need anything else. It's really that simple. And thus also super convenient. You always have your hands with you, whereas you don't always have a pump with you. And it's super beneficial. Again, I'll go over all this now. So I'm not going to whip out a boob and show you how to hand express here. I do have very few limits, but that is one of them. I'm going to give you a 2-second. But Stanford, the NICU at Stanford has an amazing how-to video that's the link I just put in the comments. So go over and watch. It's 6 minutes long. Here's the thing. Hand expression, because it's got its own term and people don't talk about it much, it sounds hard. It is not hard, ladies. It's basically as easily as squeezing your breast once you've begun to lactate. So I think if you're holding your boob like this, you put a hand, thumb, finger, this would be your nipple right here on top. Now from the side, you squeeze and then compress a little bit towards the nipple. So you do that a couple times, and then if you're on a clock, if you're on 12 and 6, you rotate a little bit so you're on 1 and 5. No, that's not right. 1 and 7. Do the same thing. So you just are rotating all the way around the nipple. Again, watch the video. So much better, and they actually have real women demonstrating. But it is literally that simple. This is not a difficult thing. You don't need someone to come in and make an appointment and teach you. Just watch the video. It's very easy. And I don't even want, if you're pregnant, girl, don't watch it now. You got enough to worry about. Bookmark it on your phone. After you push out your baby in the hospital, when you're laying there, bring up the bookmark and watch it then, because it only takes 5 minutes to see it. You can do it along with the video and you're done. You're a pro. So if you get nothing out of this happy hour, watch the video on hand expression, and don't even watch it. Bookmark it on your phone, and remind your partner to remind you to watch it right after you've had your baby. So it's obviously super convenient. There's no pump needed. A lot of women want to pump in the hospital, and then they need to wait for a pump to be brought to them. CDC's got these new horrendously obnoxious guidelines that are very safe about cleaning pump parts and all of that. And obviously you don't need to deal with that if you're just doing hand expression. Also, particularly right after you have your baby, hand expression is very efficient for removal of colostrum. So colostrum is the first couple days after you have a baby, when your breast milk kind of will look more like olive oil when it comes out. It's very thick. The reason it's so thick is because it is so full of proteins, particularly immunoglobulins. So those antibodies are actually proteins, but that are so good for the baby. But there's very small volumes of colostrum, and the pump is as good at removing it as hand expression. I mean, they've done studies and they show that it's a little better, but my experience is working with women that it's not that much better. And when you pump colostrum, two things. One, you lose a lot of the volume because your pump's got a flange, a tube, a bottle, a little catcher inside the tube. When you're pumping, a teaspoon, it can get stuck in all those places, and then the baby never gets it because you can't get it out of the bottle. Two, pumping colostrum is literally the most depressing thing in the whole world because sometimes you don't ever even see the milk. It's not going to fill up a bottle. It's not even going to coat the bottom of a bottle, and it just looks depressing, even though it's not. But it can be very demoralizing to a mom who's trying so hard to not see much volume come out. So hand expression wins there. So, and then especially, like I said, when you hand express, you're going to hand express, the drops are going to come right out of your nipple, and you take like a little Dixie cup. So they have colostrum cups in the hospital that are literally just like plastic shot glasses that you just drip it off your nipple into, and then you feed it directly to the baby. So there's no volume lost. The baby gets every little drop that you express. And for colostrum, every little drop really does matter. It's really magical. So those are some of the benefits. Some of the other benefits are, this is not research proven, but I think it matters. Especially if you are a first-time mom, girl, it gets you familiar with your boobs. You are going to be nursing, handling your breasts, dealing with nipples, ducts, all this stuff. Like, you are suddenly going to become a breast expert. And our culture doesn't really embrace that earlier. Like, all of a sudden you go from never worrying about your breasts to them consuming your life. So get up in there, get familiar with them, just like you'd get familiar with a bottle, this tool to feed your baby. So I think it's really good. It just gets you comfortable with your own anatomy, gets you comfortable with how your milk comes out of your breast, which, is usually different than you thought it was going to be. So I think that's really good to just be thrown into the mix like that. And it improves breastfeeding outcomes. So they have done studies where they taught women hand expression versus teaching them how to use a pump really early on, and showed that women who were randomized to a hand expression group had better breastfeeding outcomes, meaning they breastfed for longer. So we don't know exactly why, but I think it's because of those reasons that they became more comfortable with all the equipment, and also because like I said, for this whole supply-demand issue, which we'll talk about and continue to talk about, it gets you off to a great start in those first couple days after you have your baby, which are pretty critical for establishing your breast milk supply. So what else should we talk about? All right, so here are some of the other benefits to colostrum for the baby, and how I think it's so awesome particularly in the hospital and in the first couple weeks after you bring your baby home, that neonatal period, the first month. So one, especially in the hospital, and I think it should be universal practice that, especially first-time moms, because when you're a first-time mother, your milk takes a little bit longer to come in. That first-time mothers should all be counseled to hand express after they breastfeed. Now, if your baby has just nursed, likely nothing will come out. But two reasons, two good things. One, if nothing comes out, hand expression, still like a pump, will help stimulate the breasts a little bit to send the signal that, like, okay, baby's done nursing, but like, he could have had another drop or two. So in those first couple of days when you're establishing your breast milk supply, it's nice to have that extra stimulation. Whereas the pump might be overstimulation. I would never recommend that every mother pump after she breastfeeds, but hand expression floats that nice fine line of it's, you know, likely not going to induce an oversupply, but sets you up to have a really good supply, not have to worry about supply issues. 2, it helps get those extra drops into sleepy babies. So sleep babies are sleepy for a ton of reasons. Early babies, and by early I mean like a 37, 38, 39 weeker, some 40 weekers if we don't know the gestational age. Are you okay, honey? Come over here. Oh, I'm sorry. We're having a little argument. Oh. Come here. This is my microphone. Did Kitty throw it? It's all right, honey. We're having an argument over a garbage can. So it ensures they get that last drop. So for example, Vaughn, I didn't even plan this, was born at 37 weeks. And he, like every 37 weeker, was sleepy. He would fall asleep almost immediately upon having a couple drops of breast milk, and had a more, it was probably a normal suck for a 37 weeker, but more of a weaker suck. And so those last couple drops are really hard for small babies, early babies, and even just some term babies to get out. So squeezing that little last drop out encourages the breast to continue to make more, but then you can feed it to them. They're right there. You can use a syringe, your finger, cup feeding. You don't need a bottle. Like, you've got all the equipment on your body. So I think it's amazing for that. No colostrum loss of the pump. So they really get so we covered that. No, honey, that one's not a toy, but you may play with this. What do you say? You're welcome. Also, yeah, and like I said, it's good. I've already kind of harped on this, that some moms who are having breast milk supply issues do get recommended, and I support this, to pump after every breastfeeding session. Honey, the answer is no, it's not a toy. You may get down and play with something else. You may not play with a microphone. But hand expression, I think, is wonderful for every mom who's not necessarily having supply issues or has no risk for supply issues, but just, wants to have the best possible start. Another reason that hand expression is great, if you have a boy, and if you choose to circumcise, or even if you have a girl, any procedure in the hospital. So some babies find the ear test kind of stressful. Circumcision is clearly a stressful event for a baby to go their neonatal, the birth heel prick or venipuncture, depending on your hospital. All those things are stresses, and it often makes babies very sleepy. So those are external things that we as a modern society do to a baby that can, it's not necessarily interfere with breastfeeding, but interferes with their normal sleep cycle, because they can get stressed, and then some babies' response is to be very sleepy. And so they wouldn't wake up to nurse as quickly as they may otherwise. Sure, honey. So hand expression is great for that. In fact, when I work with parents, if they're having a boy and they're planning on circumcising him, I tell them, if he's really sleepy, don't necessarily wake him up, but hand express a few drops, and then you can go ahead and just drip it into his mouth, rub it, or save it for him when he wakes up, so that you're still getting that stimulation, and the baby is still getting the milk that they probably would have otherwise gotten if we didn't have this external procedure that we implement on our babies for safe reasons. I'm not taking a stance either way. I'm just saying that we can do things to proactively protect our breast milk supply when dealing with some of these normal health procedures that babies undergo in the hospital. Okay. And so last, hand expression is, so I encourage, if possible, to try to make it a practice to, whenever possible, do a little bit of hand expression after as many feeds as possible, every feed for the first month. Now, if you end up with an oversupply, you could cut it out. But it's really the first 2 weeks especially are really critical in your body settling out to, like, how much milk does this baby drink? Because babies drink very different amounts of milk. So, after you nurse your baby on one side, before you move them to the other, or you'll probably, you'll be a pro, you'll get normal to, like, having it with one arm and hand expressing with the other, to do that on every side after the baby's done. This helps for multiple reasons. One, I'm harping on the supply issue. But 2, it also helps you keep in touch with how much milk your baby is drinking, which is, like, the #1 concern for moms. I'm a mom, it was mine too. Like, how much milk did he actually get? Is he going to grow? You're so panicked. Well, if you hand express and nothing comes out, like you can't get a drop to come out, you probably drained your breast pretty well. If, you hand express and a stream squirts across the room, well, he probably left a significant amount in there. And that can also give you some room to play around with your feeding on each side, ensuring that the baby is getting that creamy hind milk, which is the last little bit of the milk that's left in a breast that often, if you're just nursing and waiting for the baby to either like fall asleep or lose interest, you don't know. You don't know if they got the hind milk or not. So you got your hand, give it a little squeeze. Zero need to feel embarrassed. This is a tool to feed your child, and see what happens. And then, after you do this for a couple times, you really begin to get very much in touch with your natural flow of one side produces more, this breast milk looks this way. It really helps to get a really good gauge and connection about the system that you're using to feed your baby. So on there, I think I have done enough benefits for hand expression. If you're just joining me, you can go back to the beginning and watch all about it and all my tips. Oh, here's a tip for hand expression. So when you go to the hospital, I didn't put it in my birth plan, but I always encourage people that first thing to do after your baby is born is sign up for a lactation consult. Even if you are never, I am a lactation counselor, and the first thing I push the baby out, I'm like, oh my God, he's here. I'd like to see a lactation consultant. The reason I recommend this is because lactation consultants are amazing. And the women in the hospital deal with, and obviously they deal with newborns every day. So that's a very specialized, 24-hour window, and they're spectacular. The other reason is lactation consultants in hospitals are usually in incredible demand. So a lot of hospitals have a staff shortage. And so rightly so, lactation consultants are prioritized to women who are having severe difficulties or a baby who's having trouble growing, babies who are at mom-baby pairs who are at high risk. And they should be prioritized there. But if you request, then your name gets put on that list and bumped up. Whereas if you don't request, you can get discharged before the lactation consultant has a chance to come see you. It's different for every hospital, but a lot of big hospitals in big cities have this staffing issue. So one, request a lactation consultant literally when the baby crowns. And then two, ask them as soon as you're in the room, ask your nurse to bring you a colostrum cup, which I said is literally, it looks like a tiny plastic shot glass. There's nothing special about it. It's just a tiny cup. And a feeding syringe. You don't need to use a feeding syringe to feed your baby. If you have very clean hands, you or your partner can finger feed if your baby is healthy, which is just, again, we have a fancy term. It's just dipping your finger in the colostrum and putting it in your baby's mouth, and they will suck it. But a syringe is a little more, it's nice because then you can see exactly how many cc's, which is the milliliter, that your baby got. So request those right away, and then if you don't use them, they don't cost much. You don't have to feel bad about throwing them away. But then you have them there, and then after when you're doing all this hand expression, save it. And then, when you get, a few drops, enough to take up in the syringe, feed it to your baby. So those are my other tips, is think about talking with your partner. You have your whole birth plan, then once the baby is in your arms, request a lactation consult and ask your nurse to bring you a colostrum cup and a feeding syringe. Just so you have them, and at 4 a.m. when you decide to do hand expression for the first time, you're prepared. And now you have a link in the comments to the badass video that Stanford has that shows a lot of really great hands-on, I didn't even plan that, hand expression. And do not be intimidated. It is so, like I said, it's literally as easy as squeezing your breast. I mean, there's a little more finesse to it, but it's that simple. It does not take a PhD. So I entitled this The One Thing because I really think hand expression is overlooked. And for the vast majority of mothers who deliver healthy term babies, it's something that is just so underappreciated for how much it can help get breastfeeding off to a really awesome start. So I really hope this helps. If you know someone who is expecting, please share this video with them, or at the very least send them the link to the Stanford video. But hopefully I gave you some tips that'll keep you extra motivated to give it a try and know how to incorporate it into your feeding routine so that it'll give you the most bang for your buck. And lastly, if you want to sign up for the Parents to Be conference, I'm super excited to be speaking. I'm speaking at the end of February 21st. But there's really awesome speakers starting February 1st. But everything is recorded, so you never have to be there live. And it's all online, so you never have to take off your stretch pants. I love pregnancy. I do not love being pregnant. I love pregnant women, though. So if you're interested, go over to babyformulaexpert.com/expecting, and there's all the details there. Tickets are only $24.99, so it's a really awesome deal, and there's a ton of discounts that are being offered by all of the different speakers and vendors who are participating. So I hope that is helpful. Did I have any other? Oh, I'm sorry, you guys. I had a couple comments come in, and when they come in too fast, I don't see them. So I will close this out, and I'll answer comments if I can answer them. Thank you so much for watching. If you are no longer pregnant and have already birthed your baby and are having some feeding issues, it would be my great joy to chat with you. I do free 15-minute consultations on my website. You can also sign up right on the Facebook page. So head over and check it out and sign up for a time to talk to me. I would love to hear about your precious baby. You guys have a wonderful week, and I will see you next week. I can't wait. Bye, guys. What, honey?